Typically, the vast majority of people who use cannabis do not progress to using the drug regularly or for long periods of time, with most ceasing their use in their late 20s. However, some people develop significant problems with the drug. Research indicates 1 in 10 cannabis users become dependent on the drug. Dependence most commonly occurs within a year of initiation, which is much slower than for other drugs like heroin and cocaine. The risk of cannabis dependence increases the earlier a person begins using, the more frequently a person uses, and the more heavily they use it during adolescence. A cannabis user who is dependent uses cannabis just to feel normal. Cannabis dependence is diagnosed as when a person experiences at least 3 of the following in 1 year. Tolerance to the effects. Withdrawal from cannabis, such as irritability, trouble sleeping, and craving for the drug. Using more than was intended. Persistent desire to stop taking cannabis and being unsuccessful. Spending lots of time obtaining, using, or recovering from the use of the drug. Giving up important activities in favor of using cannabis. Continued use even when it's known that it is causing problems. There are a number of other risk factors that can be associated with becoming dependent on cannabis. If young people have experienced adverse life events, family dysfunction, behavioral or emotional problems during childhood, and have parents who use cannabis and other drugs, the chances that they will become dependent on cannabis is significantly increased.